Are all strokes caused by aneurysms? A ruptured aneurysm is a common cause of hemorrhagic strokes, where bleeding occurs in or around the brain. However, most strokes are ischemic. They happen when a blockage occurs in a blood vessel. An ischemic stroke does not involve an aneurysm. 80% of people who have a hemorrhagic stroke, one that involves bleeding rather than a blockage, have a ruptured aneurysm. Are there warning signs before an aneurysm ruptures? An aneurysm does not cause any symptoms until it bursts, but warning signs can precede a rupture. They include weakness on one side of the face, a loss of balance, vision changes, and other symptoms. Around half of those who have a ruptured aneurysm experience a sudden onset headache 6 to 20 days before the rupture occurs. Strokes and cerebral aneurysms both involve blood vessels in the brain. An aneurysm is a bulge in the wall of a blood vessel. If it bursts, a hemorrhagic stroke can occur. A stroke results from a blockage in a blood vessel, but symptoms can be similar. An aneurysm often does not cause symptoms unless it bursts or ruptures. Most diagnoses happen during imaging tests for another condition. A doctor will likely monitor the aneurysm and advise a person on how to prevent it from worsening or rupturing. All cases of stroke and ruptured brain aneurysm are medical emergencies. As they can be life-threatening, the symptoms can be similar. They can all lead to paralysis on one side, a loss of balance, difficulty speaking, and headache. However, an aneurysm or hemorrhagic stroke is more likely to produce a thunderclap headache, sometimes described as the worst headache a person has ever had. Aneurysm versus stroke symptoms. If an aneurysm has not burst, there are not usually any symptoms. A burst aneurysm can lead to a hemorrhagic stroke, a key symptom of which is a thunderclap headache. With an ischemic stroke, a headache can also occur, but the most noticeable symptoms are paralysis and weakness on one side, difficulty speaking, and facial paralysis or a loss of feeling in the face and upper arm. A hemorrhagic stroke or burst aneurysm can also involve paralysis and other symptoms, but the thunderclap headache is more noticeable. Any type of stroke or a burst brain aneurysm will need emergency treatment. As both can be life-threatening, a doctor may also recommend surgery for any aneurysm at risk of rupturing or monitor a low-risk aneurysm. The prognosis for any stroke or a burst aneurysm varies widely depending on the severity, how soon a person receives treatment, their age, and so on. The mortality rate for a hemorrhagic stroke due to a ruptured brain aneurysm is around 25% within 24 hours. Around 18% of people who have a hemorrhagic stroke die suddenly before reaching the hospital. In high-income countries, around 15% of people do not survive longer than 30 days after an ischemic stroke. Those who survive may face long-term complications, including a risk of recurrence. There may also be brain damage that affects movement and coordination, speech, the ability to think and reason. Recovery can take weeks or months, and a person may continue to experience problems. Ongoing rehabilitation can help an individual remain independent and daily functioning, but some people will need long-term full-time assistance. Aneurysms and stroke are not the same, but a ruptured aneurysm can lead to a hemorrhagic stroke and bleeding in or around the brain. Symptoms of an aneurysm that has burst or is likely to burst include a thunderclap headache. This is also a sign of a hemorrhagic stroke. Other common symptoms include weakness or paralysis in one side of the face and difficulty speaking and thinking. An ischemic stroke results from a blockage rather than bleeding in the brain. Any stroke can be life-threatening. With rapid treatment, a person can recover. However, they may continue to experience problems with speech, movement, thinking, and other functions. For this reason, it is essential to seek emergency medical treatment if anyone appears to be experiencing a stroke or burst aneurysm.